you suffering from burning, hot, red hands, face, or feet? Do you worry it may be erythromelalgia or something else? Let's break it down. I'm Dr. Lauren Sparks. I'm a doctorally prepared nurse practitioner. I'm also a therapist. I've walked through the fire of erythromelalgia as well as chronic inflammatory response syndrome, and I'm here to tell you I have hope for your healing, lots of it. So when we have EM, it often starts with either our feet, hands, or face having a burning sensation. It'll often heat up, so it's warm to the touch. It will often become red, and it has, again, this burning sensation that can be very uncomfortable. Early in my EM disease process, I noticed that when I got out of the shower or the bath, my feet were strangely red enough that I noticed this is not normal. But they weren't actually painful yet. When we have EM, as it progresses, it does tend to become painful. When we have EM, it generally, for most people, will occur in the feet, although for some people, it will start in the hands or in the face. And what I see in practice is that if it does progress, for instance, mine progressed from my feet to my hands. If it's in someone's face and it progressed, it would often go from the face to the hands to the feet. So it usually moves either directionally up or down from the body. That is not something that I've seen in research, but it's just something I've noted in my practice interacting with many different people that have EM. So how do you know if what you're experiencing is EM? Because there certainly are many other reasons that you could have this hot, red burning sensation in an extremity. Well, first I want to ask you, do cooling techniques help? This is sort of like a cardinal symptom of EM, is that people often seek a cooling method. And even if it's not something extreme, I, for instance, would often want to take my shoes off and put them on the cool tile floor. This was a cooling method. Some people will begin to not wear shoes altogether. Other people will stick their feet in cold bath water, or the extreme is even putting their feet on ice. We do need to discuss why you want to avoid extreme cooling techniques, and that is because it can lead to ulcerations and breakdown of the skin. But it's important to note that if cooling helps, it could be EM that you are dealing with. The other thing I would note is, does heat exacerbate the symptoms? Does heat make it worse? Do you find you are avoiding getting in your hot car during the summer? Are you avoiding exercising because the overall heating up the temperature of the body causes flaring? If heat exacerbates symptoms, it may be EM that you are dealing with. With EM, I've also noted that oftentimes if it's in the hands or feet and we elevate the extremity, we can see an improvement in the discoloration. So if the extremity is bright red and if we elevate it, we can see sometimes almost an immediate slight improvement in that discoloration with EM itself. I do want to say that when we have EM, we can have these intermittent flares. For some people, EM can become constant. For me, it did. But most patients will have this intermittent flaring where they have this uncomfortable, red, hot, burning pain, and then their extremity may go back to what would be considered normal or baseline. Patients often recognize in time that there is a purple discoloration that can occur when the extremity is not flaring, or even sometimes when the extremity is flaring. You will sometimes hear that Raynaud's is often sort of coexisting with EM. For me, I got a diagnosis of Raynaud's probably 10 years before EM showed up in my life. I think there's debate in the EM community about whether or not Raynaud's is a distinct disease process different than EM. I think the important thing to note is both are vascular dysfunction. Let's talk a little bit about the difference between EM and CRPS, or complex regional pain syndrome. I was misdiagnosed actually with CRPS instead of EM, and that sent me down a whole scary rabbit hole of thinking I had CRPS. This happened for several different reasons. I'd had a surgery on my foot due to a nerve entrapment. And so when I had EM, the foot that I had the surgery in actually looked worse. The flaring was worse than in the other foot. And the flaring was not very pronounced in the other foot. It happened very rarely. You can have EM in one side of the body and not the other, although that's more rare. That would be more of a CRPS, would be it's just my left foot or it's just my right hand. CRPS can often occur post like some trauma, and so it can occur post surgery, which is why I think I may have received this misdiagnosis. CRPS is just also much more widely understood within the medical community. Erythromelalgia, even though I have a medical background, it's something I had never heard of. You don't learn about it in medical school and nursing school. There's not even a 10-minute snippet on it. And so I just had, quite frankly, the luxury of seeing a medical provider who happened to identify it. He had seen it before. He asked me the questions that I'm asking you. He asked me to lay back on my back and put my feet in the air, and he saw that discoloration improve, and he said, I think that you have erythromelalgia. He said, I don't know how to treat it, but I think that that is what you have. Of course, if you have a red, hot, burning extremity, I want you to see a medical provider. I want you to get an appropriate diagnosis. I don't want you to make guesses. There can be things that need to be treated immediately, for instance, with an antibiotic. And I would not want you to diagnose yourself via a YouTube video. And the reality is that many people find out that they have erythromelalgia by Googling something like burning hot red feet. And what I would encourage you to do, especially if your flares are intermittent, is to take pictures of those flares so that you can carry them with you to your medical provider. Very rarely a medical provider will induce a flare, but that often means getting a hot bucket of water, making you extremity in it, sitting around for 5 or 10 minutes. And this is just not something that is very practical. So many people receive a diagnosis of EM when they bring pictures to their provider. I also think it is very reasonable for you to say, I've been reading about something called erythromelalgia, and I just wonder if that could possibly be what I have. It's unlikely that your medical provider will know what that disease process is, but again, they could Google it. They can look it up on UpToDate, and they can help you work out where you might go to receive treatment. There is a list that I will link that lists different providers that are known to be familiar with erythromelalgia. Unfortunately, it doesn't belong, treatment for EM doesn't belong to any one specialty. Some people will see dermatology, some people will see neurology. And so it's finding somebody close to you that is familiar with the disease process itself, which will be most helpful. I also feel like it is very important to share that I was able to put my erythromelalgia into complete remission by treating something called chronic inflammatory response syndrome. If you find that little tidbit interesting, check out this next video on putting my EM into remission and how CIRS played a role in that. If you're benefiting from this channel, please do like and subscribe. If you have a question for me, please leave that in the comments. And until next time, take good care and hold on to hope.